today's video is the continued lessons from last video, which is about the treatment and care. And today we're going to the E point, which is applying cold. So a cold compress can be applied to an area of the body where the person is experiencing inflammation and swelling due to injury. And a cold solution decreases the amount of circulations of the blood in the swelled area. And cold compresses help control bleeding and reducing swelling in ankles and other joints, and relieve bruises and stings, and help lower fever. So these cold compresses can be made by filling a plastic bag water and ice, or by soaking a towel in a solution of ice and water. And the next point, which is about applying and removing bandages. So applying a bandage to an infected area helps keep dirt and germs out of the wounds and protect it from additional injury. And medicated bandages help speed up the healing process. So before applying a bandage, clean the wounded area and control the bleeding. Apply a sterile bandage or gauze and tap to the area. Leave the bandage on the injury for at least 20 hours. And be very gentle when removing bandage, like yanking off the tap or bandage can harm the wounds. And the best procedures is to soak the bandage in cold water to loosen adhesive tape, then remove the bandage carefully, slowly pulling in the same direction as the injury to prevent reopening the wound. And the next point, which is about treating minor earache. So ear drops may give comfort to an earache. However, if pus is found in the ear, do not use any kind of ear drops unless instructed to do so by a physician. So to insert ear drops, have the patient lie down on his side with the aching ear facing outward. Hold the tips of the medicine dropper at the opening of the ear, like the ear canal, and administer the appropriate dosage of medicine. Do not insert the dropper into the ear canal. Like, ask the person to keep his head to the side for a few minutes to allow the drops to lubricate the ear canal. And acetaminophen can be given to help reduce the earache pain, and a warm compress can be used to give additional relief. If the pain persists, the patient should see a physician to prevent permanent damage to the eardrum. And the next point, which is the 8th point, about treating minor ear irritations. So if a small object such as sand or lint gets into the eyes, there are simple procedures to remove it. Pull the lower lid of the eyes down gently and ask the person to look upward. So the next point, which is about treating minor eye irritations. If a small object such as sand or lint gets into the eye, there are simple procedures to remove it. And the person to look upward if the speck is visible, and gently pull the upper eyelid down. This will cause tears to accumulate in the eye and wash out the object. If that procedure is not success, then flush eye with lukewarm water. And in the event an object becomes embedded in the eyes, cover both eyes with a sterile compress and quickly transport the victim to an emergency room. And do not attempt to remove the object. Conjunctivitis, another type of eye irritation, is commonly called pink eye. This infection is caused by bacteria in the lining of eyelid Symptoms of pink eye included a red, irritated eye, and a burning sensation in the eye. So pink eye often follows a cold or sore throat because pink eye is very contagious. Like the patient should refrain from the close contact with other people. So like until the infection is gone. Other precautions include washing hands frequently and using separate towels for face and hands and washing lips daily. So the last point, which is bedside manner. The bedside manner or behavior toward all ear person can influence his recovery. All sick people benefit from knowing someone is interested in helping them recover. A cheerful, reassuring spirit can brighten the day of a person who is ill. So performing simple activities such as brushing their hair can greatly encourage an ill person. Those who are totally disabled can benefit from a caregiver who will patiently feed them. So yeah guys, this is all about the basic treatment and care, and I see you in the next video.